the general concept would be to try to be on some sort of a SIBO diet, right? There's a huge range of SIBO diets from very restricted to not that restricted. When your test is negative, as we discussed in the training, for maybe 2 to 3 months, just to see how they're going to do with relapse, right? So the broader diets are going to be like a low FODMAP, but very nicely fully expanded, or because low FODMAP diet, it says that you restrict to low FODMAP only for a certain amount of weeks, and then you start trying, right? It's a challenge diet. You start trying higher FODMAP foods and expanding. So that's kind of what I mean, like a sort of an expanded low FODMAP. Or you could do Cedar-Sinai, Dr. Pimentel's. That's not as restricted. So those are some options. But within that time, I really think it's okay for people to be experimenting and seeing what they tolerate and don't. If something goes poorly, it's usually just when their test was negative, it's usually just a day of mild symptoms. I mean, maybe something bothers them, but you can be on the ready with a SIBO symptomatic relief suggestions handout with all the supplements. So that's the idea, is go into some sort of a not as restricted SIBO diet for some amount of time. It's going to so depend upon the case, right? And what the person's willing to do. Some people are very afraid and they're like, I absolutely want to be on a SIBO diet. I don't want this coming back. Other people are like, I am fine. I am not going to do a SIBO diet. Many people tolerate everything the moment their test is negative. It's astonishing. I get these reports. It's like, well, I just went out to Starbucks and I had all this dairy with lactose, and I had all these foods and all these things, and I ate, and then I had something with garlic and onion and I'm fine. So, you kind of also have to go with where the patient's at.